This is the Behavior Change Project Replication presented by Melanie Hamblin, Angie Horn, myself, Joshua Kraus, Ashley Miller, and Kathy Schwer. Our original study, titled The Effects of White Noise on Off-Task Behavior and Academic Responding for Children with ADHD, was conducted by Andrew Cook, Sharon Bradley Johnson, and C. Merle Johnson to evaluate the overall effectiveness that white noise has on reducing off-task behavior in ADHD students. The study that we replicated included 3 participants, all males between the ages of 8 and 9, and all with an ADHD diagnosis. The setting for the original study was in the participants' classroom, and they were observed as they worked on assigned worksheets. There were 2 dependent variables measured, the first being the total number of occurrences of off-task behavior, and the second being the percent of items correct on a worksheet. There were 2 different interventions measured. We followed an ABC-AC design, which included A phase being baseline, in which there were no interventions used. B phase were conducted using noise-canceling headphones only. And then C phase, which was conducted twice as well as was baseline, included noise-canceling headphones plus white noise. The results of the study showed that for all participants, off-task behavior was reduced during headphones only and headphones plus white noise intervention phases. That being said, the percentage of items correct was not clearly affected by either intervention for all participants involved. Our literature review consisted primarily of researching white noise. So what is white noise? White noise is sound that is produced when noise of different frequency but shared intensity is produced. White noise is considered aperiodic sound. What this means is that it does not follow a pattern, as does periodic sound. White noise can be used to mask other noises. 77 decibels was found to be the optimal level to reduce reaction time while completing arithmetic or math worksheets. The most therapeutic decibel level ranges were from 65 decibels to 85 decibels. Anything over 120 decibels could lead to tinnitus or the ringing in the ears and possibly temporary or permanent hearing loss. So what are the benefits of white noise? Possible benefits include it could reduce crying in infants and young children. It could mask tinnitus, which is the ringing in the ears if you are already experiencing that. It can help hospital patients improve sleep, and it can reduce the time that infants and toddlers are awake before falling asleep. So this is not included in the slides, but some possible types of white noise include, especially for young children, womb sounds, or sounds of a mother's heartbeat, or as children get older, it could include ocean waves or a gentle rain outside or thunderstorm. Here is a synopsis of some recent studies about white noise. A study by Soderlund, Silkstrom, and Smart in 2007 showed that tasks performed by students with ADHD were completed with greater accuracy and at a similar accuracy as compared to students without ADHD. Another study by Soderlund, Silkstrom, Loftusness, and Sanuga-Bark in 2010 reported students that were considered to be inattentive by teachers saw an increase in sentence recall compared to a group of students with no white noise being played. The study that we replicated by Cook, Bradley Johnson, and Johnson in 2013 suggested that white noise decreases off-task behavior because it helps to cancel out distracting noises that would lead to off-task behavior, such as the talking of other students. So what are the effects of white noise on the brain? Noise affects all parts of the nervous system. According to Soderlund et al. In 2010, a study that was previously mentioned in previous slides, white noise allows for an increase in attention, memory, and performance because of the phenomenon of stochastic resonance. So what is stochastic resonance? Stochastic resonance is a phenomenon where a signal that is normally too weak to be detected by a sensor can be boosted by adding white noise to signal, which then creates a wide spectrum of frequencies. Usher and Feingold in another study found that stochastic resonance was found in cognitive tasks where white noise improved the speed of arithmetic computations in people without ADHD. So basically, when stochastic resonance was present, people without ADHD were able to complete math formulas or computations faster because of white noise. Attention and mnemonic processes, or simply the process of remembering things, depend on dopaminergic signals. So dopamine is a central element in the brain that controls learning of many behaviors, including motor behavior, motivation, and working memory. It is then theorized that since white noise increases stochastic resonance, it can be used to improve accuracy and potential speed of work performance due to the increase in dopaminergic signals. How and why white noise creates stochastic resonance is not understood. However, a study by Soderlund, Sickstrom, Loftusness, and Sanuga-Bark suggests that different types of brains require different amounts of stimulation for optimal function. The effects of white noise differs. In children ages 8 to 10, white noise has diminishing effect on super attentive children, little to no effect on attentive children, and the greatest positive effect on inattentive children. Finally, Furnham and Sturbach examined the effects of white noise on the cognition of adults who were either considered introverted or extroverted, and found that cognition in introverted individuals was diminished by white noise, while extroverted individuals did not show the same diminishment. And now I will turn it over to Ashley to discuss the purpose of the project.
The purpose of our project was to examine the effect that noise-canceling headphones plus white noise can have on decreasing instances of off-task behavior, assess whether white noise can increase academic performance, and attempt to replicate the steps, procedures, and methods as close to the original study as possible. Our study had 5 participants, 1 male and 4 female, ranging in age from 24 to 48. All participants are online graduate students at Ball State University and did not know each other before the start of the project. Sessions were conducted in different states in the Eastern Time Zone at the participants' homes on weeknights between the hours of 5 to 10 p.m. and weekends during any time period. Materials needed for the study included a computer with high-speed internet access, a webcam, Google Drive folder, printer, high school level worksheets, phone app that generated white noise, cell phone, phone app to measure sound decimal levels, timer, data collection sheet, writing utensils, and noise-canceling headphones. Off-task behavior was defined as behavior that prevents the consistency of work product. Off-task behavior was separated into 3 types of off-task behavior: verbal, motor, and passive. Verbal off-task behavior was defined as talking to another person about a subject that is not related to the completion of work. An example would be talking to another person about the weather or answering a cell phone. A non-example of verbal off-task behavior is talking through worksheets with oneself. Motor off-task behavior is defined as walking or standing that is not needed to complete the task. Examples include standing up next to one's chair. Non-examples are getting out of the chair to get more work materials. Passive off-task behavior is defined as looking at something that does not assist in completing work. Examples include checking the phone or giving visual attention to another person or item. Non-examples are looking away from work to stretch your neck or looking up while thinking. For data collection, participants recorded themselves for each session throughout all phases of the study. Videos were uploaded and shared with an assigned primary observer to record instances of off-task behavior and total % of correct answers on the participant's worksheet. Data recorders implemented momentary time sampling of 15 seconds, recorded data from 15 minutes of the recorded session, and then recorded this data. Data recorders marked off-task behavior at the 15-second mark based on the given operational definition for verbal, motor, and passive off-task behavior. The study utilized an ABC-AC design. A phase, or the baseline phase, consisted of no intervention. B phase implemented a single intervention of just the noise-canceling headphones. C phase implemented noise-canceling headphones plus white noise. Baseline was then repeated for a second time, as well as the headphones plus white noise intervention.
Methods baseline. So there are some steps to the baseline phase. So for subjects, they want to make sure that there are enough worksheets, pens, or pencils to maintain consistent work for 30 minutes. Also set up a computer or phone to record the session. Set a timer for 30 minutes and begin working on worksheets until timer goes off. Repeat these steps for second baseline phase. However, for the observer, the steps are to record off-task behavior using time sampling in 15-second intervals for up to 15 minutes per session or when worksheet is completed. Also, to record worksheets and percentage correct. Percentage correct is compared phase to phase, not by session, to see if accuracy increases when changes compared to baseline data. Methods Intervention 1. For this intervention, subjects will be wearing headphones alone with neither music or white noise playing. Participants will record 30-minute videos for each intervention. So the steps for intervention 1 include, for the subjects, make sure there are enough worksheets, pens, or pencils to work for 30 minutes. Place headphones over ears without plugging them in for use. Set up a computer or phone to record session, and then set a timer for 30 minutes and begin working on worksheet until timer goes off. For observers, the steps are to record off-task behavior using momentary time sampling of 15-second intervals for up to 15 minutes per session, as well as grading worksheets and recording percent correct at the end of the 30 minutes. Methods Intervention 2. For this intervention, subjects will be wearing headphones with white noise generator in use. The steps for Intervention 2 include, for subjects, make sure there are enough worksheets, pens, or pencils to work for 30 minutes. Plug headphones into a phone with a white noise generator application. Turn on the white noise and use the decibel meter to ensure noise level is at 75 decibels. Place headphones over ears. Set up a computer or a phone to record the session. Set a timer for 30 minutes and begin working on worksheets until timer goes off, and then repeat these steps for the second Intervention 2 phase. For observers, their goal is to record off-task behaviors using momentary time sampling of 15-second intervals for up to 15 minutes per session, and to also grade worksheets and record percentage correct. Methods IOA. IOA data was collected for off-task behavior during 20% of sessions. IOA was calculated by dividing the number of intervals that both observers recorded the same type of off-task behavior by the total number of intervals observed and converting the result to a percentage. So as you can see here, for Angie, for baseline 1, we have 98.3, 100 for headphones, 100 for white noise 1, 98.3 for baseline 2, and then 100 for white noise 2, leaving her average at 99.32%. For Ashley, we have 100 for baseline 1, 96.7 for headphones, 98.3 for white noise 1, 100 for baseline, and then 100 for white noise 2, leaving Ashley's percentage at 99%. For Josh, we have 100 for baseline, 98 for headphones, 100 for white noise 1, 96.7 for baseline 2, and then 100 for white noise 2, leaving Josh's percentage also at 99%. For Kathleen, we have 96.7 for baseline, 100 for headphones, 96.7 for white noise 1, no data for baseline 2, and then 100 for white noise 2, leaving Kathleen's percentage at 98.35%. And then for myself, Melanie, I have 100 for baseline, 98.3 for headphones, 100 for white noise 1, 98.3 for baseline 2, and then 98.3 for white noise 2, leaving my average percentage at 98.98%. So the mean overall agreement was 98.93%, range 98.32% to 99%. Methods, treatment integrity. As done in the original study, we created an 8-item checklist to ensure treatment fidelity. Our checklist includes: during white noise phase, make sure the white noise generator is calibrated at 75 decibels. During both intervention phases, headphones should not be removed for any reason. Also ensure that you're in a room area that minimizes distractions from others or things as much as possible. Have all writing utensils, papers, and worksheet supplies readily available when timer starts. White noise can be defined as noise heard in the headphones that may keep you from being distracted. So you also want to listen to the white noise before recording so you know what to expect. All members should work for the entire 30 minutes, and worksheets and packets must be the same subject of work and the same level of difficulty. These 8 steps were created to ensure treatment integrity.
After completing all 5 phases of the study, data was gathered and placed in graphs. These graphs allowed us to see if there were any relationships between the dependent and independent variables. In looking at the graphs, it was much easier than looking at numbers to see if we had any relationships between either the off-task behavior and the items correct, or the phases and the items correct, or phases and baseline behavior. What we found was that there was an inverse relationship between items correct and off-task behaviors that was seen again and again in many of the graphs. You can see this in the 4th phase, baseline. As the off-task behavior increases, the items correct decreases. With Angie, her off-task behavior stays pretty low. However, it is at its lowest point during the first baseline and her headphones with white noise phases. Her highest level of items correct is seen during headphones and white noise, but she mostly stays in her range between 80 and 100%. If you look at the mean data collection, you can see that her lowest off-task behavior happens in the C2, which is our headphones and white noise, and her highest percentage of item correct happens during during C2. Ashley had a little more variation in her items correct. However, again, her off-task behavior stays pretty low with the exception of her second baseline. If we look over at her mean data, you'll see that second baseline is 9.6% of the time she is off task, showing some form of off-task behavior. With this higher off-task behavior, again, we see this inverse relationship, and her items correct are only at 77.5% for her overall average. With the phase that seemed to have the best results, again, we're looking at the intervention of headphones and white noise, C1 and C2, have a 3.3% of the time she's off task, and both of them also show the highest correct items. Josh's slide shows a lot of variation with a few outliers throwing off his data and decreasing his items correct quite a bit. Without those outliers, he may have had a stable items correct that stayed about the same around 80%, 70 to 80%. However, those outliers really did bring down his averages on items correct. And so you see averages of 68%, 71, 82, and 70. His lowest average was actually, surprisingly, compared to everybody else, found in the headphones and white noise in the second phase. This seems pretty stable. We don't have a lot of outliers that drop down 40 or 50 points, but rather they seem to stay right between 60 and 70%. His behavior throughout stays pretty close up to zero. with his highest being 8.25 during the first baseline, and all others below 5% for off-task behavior. Kathleen's data shows a really good inverse relationship if you look at headphones only phase. As the off-task behavior increases, the items correct decrease. Again, you see that very clear during second baseline. Off-task behavior increases, the items correct decreases. We also see in both of the headphones and white noise phases that with a low off-task behavior percentage, there is a higher percentage of items correct. Kathleen had her highest off-task behavior at A2, which is our baseline 2, and the lowest at 0.8 during the headphones and white noise phase, which is our last phase of that. Percentage correct, highest percentage correct happened during the C1, which is our first phase of the headphones and white noise, and lowest percentage correct was during baseline 2 with an 87.25. Melanie also shows a really good example of the inverse relationship. If you look at her second baseline, which is the fourth phase, as the items correct decrease, the off-task behavior increases. Melanie didn't have much of a range for her off-task behavior. Her behavior seems pretty stable throughout. However, her highest off-task behavior occurs during the baseline at 6.7 and 7.5. And her lowest off-task behavior occurs in the last white noise phase, which is at 2.5. Her items correct also show a positive relationship during the headphones and white noise phase, with 98.8 being the average for both phases, and her lowest being during the second baseline phase. So once we had gathered the data for each of the participants, we took that data and found a mean average for all participants so that we could look at not just what happened with each individual, but overall what trend we saw. And what we found was that for the off-task behavior, the lowest point of off-task behavior occurred during white noise phases 1 and 2, with phase 2 having a 1.77% off-task behavior. And the highest percentage of off-task behavior occurred during baseline 2 with 9%. That had a range of 24.1 points, as we saw that during that phase, people had a low of 0% off-task behavior and a high of 24.1% off-task behavior. The items correct on task that each person completed, again, didn't have a great variation, pretty stable in that the averages, the lowest average is at 82.8%, and the highest average is seen at the first white noise at 94.3%. So the spread is only about 12%. However, we did see that white noise 1 had the highest items correct at 94.3, and baseline 2 had the lowest items correct at 82.8. Now, again, because of those outliers that we got with some of Josh's data, that might have thrown off our data a little bit. However, but even after removing that 40% that happened in the first baseline, that first baseline still ends up being below what we were seeing in the white noise 1. So what did our graphs tell us about our results? Well, first of all, as you saw from many of the slides, we had an inverse relationship between off-task behavior and items correct on the task, meaning that as the off-task behavior increased, the items correct on task decreased. If the off-task behavior decreased, the items correct inversely increased. We had higher levels of off-task behavior during baseline, and we had lower levels of off-task behavior during the white noise phase. Kathleen showed the greatest improvement. She went from a high mean of 15.6% during baseline 2 to a low average of 0.8% during white noise 2, which was a range of 14.8%. Melanie had the least improvement of her off-task behavior. She had very low off-task behavior to begin with, and her highest mean was only a 7.5%, and the lowest mean was at a 2.5%. The highest occurred during baseline 2, and the lowest occurred during white noise 2. This was only a range of 5%. The highest levels of percent of items correct was found during white noise phase, and the lowest was found during baseline. Ashley showed the highest improvement in task items correct with a low mean during baseline 2 of 77.5% and a high mean during white noise 1 of 97.5%. This is a 20% range, which really shows a good difference between the two, between the white noise and the baseline for her. Angie showed the lowest improvement in items correct. Again, if you can remember, her percentage correct was pretty stable with only I believe like a 8%, it says right there, 8.7% variation in her mean. She has a 97.25 during white noise 2 and a mean of 88.5 during the headphones only phase.
And this is Josh again. I'll be doing the conclusion section of our study. So basically, in conclusion to the whole study, we found that headphones plus white noise sound was effective in showing a decrease in instances of off-task behavior for all participants that were involved whenever headphones plus white noise sound was used as the intervention. In conversation with the participants, all participants also reported, or the majority of participants felt that it was generally easier to concentrate or focus whenever they were listening to white noise. And in further conversation with some of the participants, some reported that they'd actually started to implement white noise and listening to white noise sound while doing other things throughout their lives, whether it be working at their job or doing other small tasks here and there. And they just reported that concentration was generally increased whenever they were listening to white noise. Our study actually, so the current study, our study actually results were very similar to those found in the original study by Cook et al. And that both studies found that whenever headphones plus white noise was implemented, the result usually always ended up in decreasing off-task behavior for all participants involved. For other conclusions for the study, the current study showed that headphones plus white noise also increased task accuracy percentages when compared to baseline phases or when no intervention was implemented. Our results actually differed from the original study in that the original study, participants actually did not show any change at all during academic task accuracy whenever intervention was applied, when intervention was implemented. Overall, the current study suggests that there is definitely a relationship between white noise sound and decreasing off-task behaviors in individuals. And our finding definitely matches the majority of the literature review and other studies that are similar in the sense that have also looked at white noise and how it affects focus and concentration. And now for the limitations of our study, probably the biggest limitation we found was that in comparison to the original study that took place in a classroom, generally our study usually took place in most participants' homes, which in comparing a person's home versus a classroom, typically their homes are going to be a much less distracting environment compared to a classroom where there's other kids yelling and students are talking and teachers are giving instruction. So in general, we felt that our data might possibly have been, somewhat compromised in comparison to the original study, simply because our environment was going to be a lot less distracting than a classroom. Another limitation was that the original study actually examined 8 to 9-year-olds with ADHD. And in theory, 5 adults are probably going to have much longer attention span than, say, 8 to 9-year-olds with ADHD. So it's not going to be too difficult for us to be able to stay focused for 15 to 30 minutes at a time for our sessions. And another limitation was that the white noise generator that we used was not the exact white noise generator that was used in the study. We used phone apps, and from the original study actually used an actual device that produced the white noise. Continuing now with limitations, another limitation that we saw was that whenever the person who was recording data had to record data by means of video recording. So that means the participant had to record themselves during the sessions and then send that videotape to the person recording the data. And generally, when you're recording data and you're looking at a video, it can be kind of difficult to see if a person is actually off task or not, since you're not actually there with them while they're performing the task. Sometimes it was kind of hard to see if a person was actually just reading a question or reading, a worksheet, or if they were actually like falling asleep or had their eyes closed or not paying attention. And also there are other times, of course, since the person's at their house, there's interruptions that were occurring possibly at times from family members or dog barking or something that wasn't necessarily the fault of the participant in terms of off task, but ended up causing the participant to be off task. Another limitation we had is that in the original study, participants were given worksheets based on their school subjects. We decided that we were going to still do high school level worksheets, of course, but participants were able to choose their own worksheets. And because of this, there might have been some sort of change or aberration in the data, since all the worksheets were not uniform. And in most cases, participants typically chose worksheets that they felt they were at least proficient at or generally did well at. And now for the last slide of limitations, this has to do with the actual data collection method that the original study used and that we also use, which is momentary time sampling. And one of the problems with momentary time sampling is, since you're just looking at a specific, very specific, 1 second essentially in time throughout, every 15 seconds, you're not necessarily getting the whole picture of when off task is occurring. So you could have been off task, the second before that 15-second mark, but then on 15 seconds you're on task. But so because of that, I feel like it kind of skews the data maybe a little bit, and maybe makes it seem like it's not happening as much as it actually is in terms of that behavior. And lastly, due to the time restraints just based on the class and how we have to continue to move things along, sometimes our phases were cut short before full stability could be reached. I know this happened a few times even with just my study, just in baseline, where I felt like it could have been more stable, but I had to move on just because of the nature of the class and how we were doing things. And here are just our references that we used throughout the study. Just more references here continued. And lastly, our contribution log. Thanks so much for watching. Hope everyone has a great end of the semester.